At the time of your visit, you may notice that we have more than one premium laser technology at the center. This is because, although they all use cold laser technology to sculpt the cornea, lasers vary in their delivery systems, and we may feel that one is better suited than another for your particular prescription to deliver the best possible visual result. One of our consultants will obtain some simple measurements to be certain that you are a good candidate for the procedure. We will gauge how stable your prescription has been, as well as measure your pupils to help us to better counsel you on your potential risk of nighttime glare and halos. We will also obtain a sophisticated color map of the cornea called an orb scan to help assess the apparent stability of your cornea. During this consultation, we will also want to understand your motivations for laser vision correction and make certain that your expectations are appropriate. It is important to know that although the goal of laser vision correction may be to eliminate your dependence on vision aids, these procedures do not always create 20/20 vision. Whether or not you consider your procedure a success depends more upon your perceptions regarding your vision rather than on the actual measured results. If you would be happy with having vision that is as good or almost as good as what you have with glasses or contacts, and you would be willing to sacrifice a small amount of clarity in order to be free of your full-time dependence on vision aids, then your expectations are realistic and you should be an excellent candidate. If, on the other hand, you are highly critical of your vision, change bothers you, and you would regret having the procedure if your uncorrected vision was even slightly less than it is with your current prescription, you should have further discussions about what is reasonable to expect during your consultation. It is also important to think of laser vision correction as a process rather than as an event. Everyone responds slightly differently to the laser energy, and although most patients are able to drive the very next day, vision may not seem optimal, may fluctuate, and about 5 to 10% may require fine-tuning of their vision several months later. Most patients, however, whose vision is somewhat blurry in the days following their procedure go on to have excellent results days to weeks later. You should therefore go into the process with the mindset that you may require some fine-tuning, also known as an enhancement in the future. These enhancements are usually quite easy to undergo and do not carry the risk level of the original procedure since the existing flap is lifted to deliver the additional treatment. Enhancements are even less frequent with the newer premium technologies that I will discuss shortly.